This is the Fix Your Sciatica podcast. By the time this episode airs, I would either be in the middle of my trip in Italy or just returning back. And with this, living overseas and as I've gotten older, I started to realize that as much as we can prepare for the future, we can't 100% prepare for anything. And so it got me thinking about what is it going to be like if in the event that there's some sort of a medical emergency or if I need medical care when going overseas. So I started taking a deep dive and I came across today's guest, which is a very important guest, whose company actually addresses this problem of what am I going to do when I need medical care overseas. So today's guest is Dana Lay, the founder of Wander.health. Dana, thank you so much for being on today's episode.
Yeah, thank you so much for having me.
I'm really excited to talk about this because we live in a world now where traveling is starting to become more accessible and it's a lot easier. And ultimately, after coming out of this pandemic, I knew for myself it was important to be able to explore the world. But there are a lot of cases where we're probably going to need some sort of medical attention when we travel across countries. And so I really appreciate you being on today's episode. And so for the listeners out there, could you tell us a little bit more about yourself and how you ended up discovering or finding Wander.health?
Yeah. Well, I'm the founder and CEO of Wander.health. What we are is it's a network of English-speaking doctors that help travelers get access to healthcare when you're in a different country. We offer same-day and next-day appointments and focus on urgent care. So my journey to building this company to I myself have also traveled pretty frequently and been in situations where I, been playing charades with the pharmacist or having to Google Translate, trying to pretty much say medical words in their particular language or showing them like, hey, this is like what I mean. Or even like getting a rash and figuring out if I need to go back home now or, I can delay this the 2 weeks later that I get back home. And this was all really frustrating for me, especially because I have a background in healthcare delivery. And I could only imagine somebody who may not be as experienced or understand the nuances of healthcare may have difficulty finding and accessing it when they're somewhere foreign. So throughout my travels, that's how I felt, along with my actual personal or my more like professional background has been in healthcare innovation. I've built networks of hospitals from around the world that are all interested in innovation and working with startups. I've built 7 different accelerator programs that really support entrepreneurs in building out companies that can further help people in the healthcare realm. And I've negotiated multi-million-dollar contracts between insurance companies and hospitals, which has all really set me up for building this particular company because it's really focused on getting the best care for Americans traveling. And so we're directly working and contracting with clinics from around the world.
Wow, that is extremely impressive. It's very, very cool. And I just really appreciate you taking the time out of your day to sharing the knowledge about this. And so we're looking at travel. This may seem like a very simple question, but a lot of people are actually interested in visiting other countries. Why do you think it's so important for people to be aware of how healthcare systems work or how to access care when they're overseas?
Yeah. I know some people may have traveled during the past few years during the COVID era, and many people realized really quickly how the system was, or how navigating different healthcare systems and understanding what is required from each healthcare system in terms of the data that they need or the history that you have to have or anything like that was very convoluted. And so clearly the COVID really showcase how complicated that was. And then now because we're coming out of the pandemic and going back to business as usual, people are starting to understand the importance of travel health even more, and knowing that there may be, language barriers, access barriers, availability issues, just understanding, how to even like be able to find the appropriate the type of quality or services that you're looking for, and just may look a little different in each healthcare system. So I think it's understanding that now that people are starting to travel more, revenge travel is a big thing now. Digital nomad, becoming a digital nomad and becoming an expat is also becoming increasingly popular. That we as I'm an American. I focus on the American population. That we need to understand like how we can travel easier with all the things that we need, like on top of like the things you pack, the things you prepare for. Healthcare should also be something that people should look at as well. So it's something that you have to think about day to day, whether it's hopefully not getting sick from food poisoning, and changing your diets to even like maybe potentially getting sick in a place that you don't know anybody at. So I think that people are starting to realize that as we continue to travel more, we need to also add healthcare as like part of that preparation list.
I'm in 100% agreement with that. I had back in 2019, 2018, I had a little bit of a medical emergency myself in Mexico. I have environmental allergies, which I happen to exacerbate with heat and a little bit of alcohol drinking. And turned out when I took an Advil, it actually made my allergic reaction even worse, to the point where luckily we were on a resort and we called the resort doctor and said I was having an allergic reaction. They came in and actually asked me a couple of questions, and they injected me with epinephrine, and then my symptoms were gone. But that in itself, we were lucky because we were on a resort of Americans, and people were putting a ton of money into this area. So of course they would have a doctor. But when we're in an area where the language barrier is tough, trying to navigate that entire system, just say I need care, can be very, very scary. And so it's exciting to hear that you and Wander Health is really helping out significantly with that. And so I think you briefly talked about this, but if we're talking about like some of the big, now obviously we have American healthcare, but then we're looking at overseas and other countries. What are some of the big major differences that you've come across or observed in regards to healthcare operations in other countries?
Yeah. And also going back to your story, I'm sorry that happened to you. It actually happened, since starting this company, I've heard so many different stories very similar to that, or even worse. Fortunately enough, you had access to a doctor on your resort. And however, sometimes those doctors cost significantly more than even the same quality doctor in that particular city, but you're paying for the convenience for it. But yeah, I think from what our research has shown, 40% of people who go abroad actually get sick or injured. So it's pretty common. So at this point, everyone either has a story when they've traveled abroad, or they know somebody that has traveled abroad and gotten into a situation that is related to their health. So yeah, I completely get it. It can be really frustrating for sure. So your question is about the differences in healthcare for other countries. So it depends on how the country is set up in terms of how they deliver their healthcare to their local citizens and whatnot. So for example, the UK, they have a public and private system. On the public system, yes, healthcare is essentially free. However, if you talk to even any local, they will say, yeah, it's free, but it's only for certain health organizations that you can access to. 1, 2, the availability is months in advance. You have to book something and you'll get your appointment 6 months later. So it can be very, very hard to find healthcare when you're traveling. So that can be like, especially if you're not staying there for months on end. So then you start thinking about how do you get healthcare in general. And so I think like how it's set up can be very, very difficult. Like even in Mexico, here in the US, actually, we get I think it's about like 70% of healthcare is provided by the employer. But here, or in Mexico in general, it could be, I think it's like a significantly smaller proportion of people who get their healthcare from employers in like the teens percent. And that's hard. So people actually have to go out of the way, like figuring out who to go to, who like can trust, who's actually fully compliant. Regulations aren't as stringent compared to the US in a lot of other countries too. So that can also be a little problematic if you as an American, you as an American are expected for the same level of care when you are traveling. So yeah, there's lots of differences, but what we're trying to do is really kind of make that a little bit easier for any person traveling, getting the healthcare that they need when they need it.
This episode is brought to you by the Sciatica Protocol. Experience pain relief directly through your phone, anytime, anywhere. Interested in learning more? Check us out at ifixyoursciatica.com/the-sciatica-protocol. Right on. Yeah. So we're looking at pretty long wait times. I mean, just the wait times itself, but then also the language barrier. If you're in a place where you're not speaking the native language, it can be extremely challenging. And you briefly talked about at the beginning of this interview about how Wander Health actually pairs you up with an English-speaking physician to kind of help you navigate this system. So you kind of alluded to it throughout this conversation about what Wander Health does. Can you tell us a little bit more about what that experience is like, just so that the listeners can consider, looking into Wander Health before they go even on an international trip?
Yeah. So we are building this network and ensuring that how we're vetting these doctors as well, they are fully compliant and licensed in their particular country. We're not just going to every single clinic or every single doctor that's in each of the cities. We are ensuring that they are providing high quality care to a standard that I would be able to even recommend it to my own family or friends here. So how it works is that we have a membership, and you get the membership, you get access to a booking platform where in real time you can book directly on this platform and know that you're scheduled for today at 5 p.m. that you're going to see a doctor. The biggest kind of like value prop that we offer is that you will see a doctor today or tomorrow for whatever your medical need is. Of course, we're right now focused on urgent care because that's a little bit more geared towards, again, travelers who may have not as super big emergencies at the moment, but they need their medications refilled because either they lost it or need extra, or they fell and they need to make sure that it's okay, and they need like a small suture or something like that. Food poisoning, any gastrointestinal issues, like those little things, like we take care of. We say that we're like the international One Medical.
That's awesome. And so being able to, what Wander Health does, it seems as if you're out abroad in the cities and countries that you're covering, and you have this opportunity to have someone who can actually take a look and see what the next steps are in the event that you actually require some sort of medical service. That is awesome. I think it's extremely important, especially as we start to really navigate this world and people are starting to travel a little bit more. I know for myself, trying to map out and make sure that we're actually getting everything that we need. I recently, going off of this allergic reaction, I had the opportunity to meet with an urgent care doctor to just get a refill of an inhaler and an EpiPen just in case that I need one. And I was doing it, and I did it out here in the States because of the fact that I wasn't 100% sure what it was going to be like. And knowing that company like yours is around, it definitely gives me a lot more peace of mind and make it a lot less scary because, as much as we can prepare for anything, anything can happen. And I'm so glad that your company's around. So if someone were to be interested in learning a little bit more about your company, what is the best way to learn more and even sign up?
Yeah. So our website is wander.health. So most of the information will be available there, and we try to keep it consistently updated. So that would be the best place to get more information, and pretty easy to sign up. You get a membership, you use the platform. We're continuing to expand to different countries, as we continue to grow. So if the country that you're traveling to hasn't shown up there just yet, just let us know, so then we know that there's interest in that particular country, so then we can continue to expand it as quickly as we can, so we can help as many people as possible.
Beautiful. Listeners, if you didn't get a chance to write that down, I'm actually going to be putting the link in the show notes. Dana, this was awesome. Definitely providing a lot more or lessening the anxiety that people have in regards to just even looking in the medical issue standpoint when they travel. So I really thank you for what you do and your time.
Thank you so much. Really appreciate today. And hopefully we can help as many people who need help. And so then you can continue your travels without any issues.
Awesome. Absolutely. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.